Let's talk about middle ear infections and why they are so common when you get a cold. So, if we can go on a little bit of a journey into the anatomy into the anatomy for a minute. The outer ear, which is the canal that goes all the way through to your eardrum, your tympanic membrane, is air-filled. Obviously, air has to be able to get into your eardrum. Sound waves travel through the air and they vibrate the eardrum. Now, on the other side of the eardrum, there is a cavity that is also air-filled. And that air-filled cavity, that's called the middle ear. It contains those little bones that we collectively call the ossicles. You know, the hammer, the anvil, and the stirrup, or the proper medical terms are the malleus, the incus, and the stapes. And these three little bones are all connected essentially in a line, and as those vibrations occur on that tympanic membrane, on your eardrum, from sound waves, these bones magnify the vibration. That at the other end of a sequence of bones, the stapes, or the stirrup bone, is attached to the inner ear. So those bones are all located within an air-filled cavity, and they vibrate and magnify that vibration that is attached to another membrane, the oval window, on the inner ear. And you'll recognise when you look at a picture of the anatomy of the ear, the inner ear is that thing that's got the little snail, it's the cochlea in there. So ultimately what's happening is sound waves are converted mechanically to some mechanical energy that those bones will oscillate, the ossicles oscillate, and the end bone, the tiniest bone in the body, is called the stapes, or the stirrup, is connected to the oval window, which is another tiny eardrum, and on the other side of that is fluid. And of course that vibration is transmitted through to the fluid. As those energy waves, those sound waves vibrate through the fluid, they stimulate little hair-like nerve cells that transmit that into electrical energy that goes to that part of the brain that looks after interpreting what you thought you just heard, right? So that's the interpretive or the sensory side. But in that middle ear, that's conductive. And we need those bones to be able to vibrate. We need the eardrum to be able to vibrate. And when somebody's got an ear infection, often what will happen is that middle ear, so otitis media is the proper term for it, that middle ear will fill up with mucus and fluid. And the reason that it fills up with mucus and fluid is the absolute opposite of the reason why it's normally filled with air. So, it's an air-filled cavity because it has a small tube that runs to the back of your throat. And that tube is called the eustachian tube. The eustachian tube constantly allows for air to come from your throat up into your middle ear to be able to equalise the pressure inside that middle ear space. If it's under too high a pressure, the eardrum bulges and those bones don't oscillate so much. And you probably experience that when you're on an aircraft and we're about to land. If you don't pop your ears and push some air from your throat into, or the back of your nose into your middle ear, you get a sense of deafness. And then you pop your ears and suddenly you can hear again, right? So that's that mechanism of maintaining equalisation.
Hannah Crow, could you please contact the staff at the front reception desk?
Guess where I am. Okay, so it has to be full of air. But the inside of that cavity is a mucous membrane. So it's like the inside of your nose, the inside of your bronchial tree. It's a mucous membrane. There are specialised secretory cells that line the inside of that mucous membrane, or the inside of the ear canal. And they constantly secrete a viscoelastic mucus that has to drain out of that exact same tube, the eustachian tube. And you're constantly making this viscoelastic fluid, like ear snot, really, and it's draining down through the eustachian tube into the back of your throat, and you just swallow it. You don't realise you're swallowing it, but you're just swallowing it. It's kind of gross, but that's what you're doing, right? You're constantly swallowing your ear snot. Right, when I get a head cold, or nasal congestion, or a hay fever, or any of those things, what I'm going to see is that eustachian tube will become swollen. And when it becomes swollen, I can't equalise by getting air up into that cavity. And that mucus that's constantly being secreted on the inside of that middle ear, that's got nowhere to drain out because the eustachian tube is swollen shut, right? So it starts to fill up with muck, with glue, and it's sometimes called a glue ear. So, blowing your nose frequently when you're starting to get a little bit of ear congestion because of this build-up of fluid, that's going to help. And so that's why we would tell kids to blow their nose if they're susceptible to ear infections every time they get a cold. Taking medications that are anti-inflammatory to try and reduce the inflammation. So medications like Nurofen are helpful in that regard to be able to reduce the swelling a little bit and open up that eustachian tube so that we can drain all of that muck. Because here's the thing, when the muck builds up, it's a perfect medium for opportunistic bacteria to be able to migrate up that eustachian tube from the back of the throat and colonise that fluid that's now moist and warm and trapped. And an ear infection can then start. So otitis media is not always an infection. It is an inflammation of the inside of that ear canal. Infection's very, very common because that mucus, if it doesn't get drained out, is a perfect portal for infection. So don't be surprised that if you go to your doctor with an otitis media, that you might be sent home without antibiotics. The most common cause of ear infections, or otitis media, is actually viral. So antibiotics aren't always going to be prescribed, particularly if it's viral. We know that antibiotics don't do anything for a virus. So that's a middle ear infection or a otitis media. So why is that a problem if you've got a constant build-up of mucus inside your ears, inside your air-filled cavity, your middle ear? Because it causes the tympanic membrane to bulge. And those little bones, they need to be in an air-filled space to be able to vibrate freely. You can imagine how difficult it is to vibrate when you're inside a really thick, tenacious, sticky fluid. So conductive hearing loss is very, very common when somebody is experiencing inflammation of their middle ear. If it's chronic and we can't drain that stuff out, then an ENT specialist may put a tiny little hole in your tympanic membrane, in your eardrum, and place a small plastic tube called a grommet inside your eardrum and let that fluid drain out through your external canal. And that's what grommets are for, to be able to drain that glue. Don't get glue ear. Blow your nose a lot. Wash your hands. Bye.